Hello and welcome to the Össur Academy webinar. This evening I'm going to be talking to you about the Miami J Select and the Miami TLSO, both new products. The Select is out now and the Miami TLSO will be coming to you shortly. So before we start, what I'd like to do is just talk you through a few of the different features of the webinar and talk you through some of the people that I've got here with me to help you present. So first of all, how you communicate with us. So type any questions you have whenever you have them through the Q&A function. If a question doesn't get answered straight away, we will come back to it at the end. You can also use the chat function. We've got Maxine on there who can actually answer any of those questions as we go through. These will all be recorded, so it does mean that you can actually go back to it. If you search on Google for Össur Webinars, it will then take you straight through, and there's a full library of all the previous webinars that we've done. We'll also send a follow-up questionnaire afterwards, and you will get an e-certificate. So if it's something that you want to put in your CPD portfolio, that's something you can do. But do go and have a look at our webinars page. We do put all the new and upcoming webinars in there. So yes, what I'm going to do is just show you the different people that are in the room with me, helping me with this. So first of all, we have the main camera here. We also have the table camera off to this side. And this actually allows me to show you how nice and up close how we can actually set up the brace, and it's just a really good way of showing this visually. Next, we have Izzy with the dynamic camera. So at the moment it's on the floor, but you can see that Izzy can actually move that around depending on what we need. We also have Pete, and Pete is the lucky or unlucky person who I'm going to be fitting the braces to. We also have Maxine, who's on the chat function. And we have Mike, who's over in the corner, and he's the one that's controlling all the different camera angles and that sort of thing. Okay, so we're just going to go into a quick presentation about the Miami J Select. And so with regards to the Miami J Select, it's about to be released. So in fact, it has been released. It was out last week. And we're just going to talk a little bit about the indications, a little bit of information about anatomy. This is just a very brief overview. Some of the features and benefits, and we'll go through a full fitting, including we'll talk a little bit about some of the other products that the Miami J Select is compatible with. There's information about the ordering information and also the warranty as well. So, quick overview of anatomy. Effectively, there's 7 vertebrae in the cervical region with 8 pairs of cervical nerves, and it's divided into 2 parts, 2 functional areas: the upper C1 and C2, and this is effectively where a lot of the range of motion, both in terms of sort of lateral movements, rotational movements, and also nodding of the head, occurs, flexion and extension, and the lower section C3 to C7. And there's a natural lordosis built into the cervical spine as part of the normal curvature as we work our way down the spine. And the purpose of the cervical spine is to protect the spinal cord, support the skull, and enable a wide range of functional movement. Effectively, we're trying to get the eyes to look where we need them to go very quickly and very efficiently. This is a diagram of the upper cervical spine. So in this, we can see C1 down to C4. And you can see right at the top, we have C1, sometimes called atlas. And effectively, it's got those 2 articular surfaces, those 2 joints on the top. And that's where the occipital condyles sit, the base of the skull. And then from there, we then have the dens or a odontoid peg. And this is where the protuberance from C2 goes up and through into C1. And this is where a lot of the rotational movements occur when we're rotating the cervical spine. From there, we then go down to C3 to C7. And effectively, these are considered as one sort of functional unit. When we're looking at X-rays, effectively what we're trying to do is to trace around the outline to see if there's any changes or any lack of congruency between those bones. Often when we're looking to consider how stable or unstable a neck is, stable and unstable is now sort of a sliding scale rather than a definitive article. Well, what we would do is actually draw a line down the anterior section of the vertebral bodies, then down the lateral processes, and then posterior at the spinous processes. And this then means that we can get a good idea of the congruency and how the spine actually sits. Going on to the Miami J Select, it's indicated for situations requiring gross immobilization of the cervical spine. These can include either post-surgery, or C-spine precautions for trauma patients. Can also be used within MND, rheumatoid arthritis, osteoarthritis of the cervical spine, or spondylitis or spondylosis. So moving on to some of the different features. The Miami J Select is designed very much with the Miami J in mind. So it's based on the same principles that we apply to maintain immobilization and pressure relieving characteristics of the Miami J. So it utilizes the same chin tray. It also includes a new feature which is called Blue is You, and this basically means that any of the blue surfaces are either facing towards the patient or they're the sections that they need to adjust. So it makes it very simple for the patient. Effectively, they can only really touch the blue sections. There's a locking mechanism built into this. So we're actually able to adjust the height of the collar, but we can actually lock this height adjustment mechanism. So if you're concerned about the patient tampering with that or potentially raising or lowering that section, you can lock it off and it completely prevents the patient from adjusting it. There's also a micro adjustment mechanism for the sternal pad. And that means that you can actually change the characteristics of that. You can stiffen that up if needed, but equally you can undo it just a touch. And it just means that you're getting a small amount of movement that may be a little bit more comfortable when the patient is sat or when the patient's eating. From the side, you can see that there's flex edges posteriorly. This is to provide pressure relief for the occiput, but it also means that the back of the collar will automatically adjust to fit the shape of the patient. The collar back has also been approved when comparing it to the Miami J Advanced to give more anatomical support. So we've changed the shaping to really make sure it contours to fit the shape of the patient. It's really important that we're utilizing as much of the surface area of the occiput in order to get the most immobilization with the lowest pressure. There's multiple height adjustments and there's micro settings between each of those. There's 7 settings, but you can actually adjust it in between. And there's an optional reproducible fit tab. So what these are is you can actually trim the end of the strap, and it makes it much easier for the patient to actually feel where the strap should be positioned. So the hope is they're actually able to very quickly reproduce the fit of the collar exactly as you as the clinician has set it up. We've also got, I know it seems silly to have them quite as bold as this, but up arrows, and it also mentions sort of back and front on the collar, so it's very simple to apply. We've all seen collars that have been fitted in an unusual setup, so it makes it very easily, and there's lots of ventilation to make this as breathable as possible. The size adjustment basically allows 7 different height adjustment positions. There are micro adjustments between those as well. And effectively, one collar is able to fit 90% of the population. So you can see that it will actually fit 5 of the 6 phenotype-based sizes that the Ocean Back is based upon. And you can see that numbering system on the side. But because of the height adjustment mechanism, it means it's very easy just to slide it to size and make sure it's in the correct position. The padding itself, the Sorbatex, there is a change in color, but also it's been treated with Silver Plus, which is to reduce bacterial growth by over 99%. And it's quick drying, so it's 30% quicker drying time compared with cotton and foam. It's 3 times the durability, so because of the sealed edges and the non-exposed foam, it is very durable for up to 3 times the number of wash cycles, and it's the same thickness as other leading collars. So I'm just going to go through a quick fitting. We're not going to sort of go through correct spinal protocol. It's important that this is actually done locally at your individual hospital. And you can see that we've got 2 sections here. So this is the standard Miami Select. You can also order these with extra extra pads if needed. So it comes with a set fitted, but you can order an extra set depending on your need. Okay, so Maxine's just going to support the head here like that, and we're just going to slide the back section of the collar into position. So it's important to think about anatomically, we want the top of the collar to cradle the tip of the occiput. So we've got someone supporting the head, we're pushing down into the supporting surface and sliding the collar through into position and making sure that we've got an even amount of collar either side. So it's nice and parallel, and we've got an even amount of positioning either side. The next thing we need to do is just actually adjust the collar according to the size that we would need. So what we can actually do is adjust the height, and you can see those 7 height settings that are down here. It's difficult to see because they're sort of in white, but we can adjust this very quickly and very easily according to whatever we need. It's also important to bear in mind that if the patient is off to one side, so in an asymmetric position, it is actually fully possible to adjust this to be lower on one side and higher on the other. So if we just move Pete's head over to one side, you can see that we can actually adjust this to accommodate that positioning. So if you notice, it's a little bit lower on this side than it is on the right-hand side. So this can be particularly useful if a patient has torticollis or a condition along those lines where the head is off to one side. So away from the patient initially, we're holding this in the center, adjusting this to the height we need, and we can actually offer this up to the patient. So I'm just going to make a touch adjustment there. And before we do this, I just wanted to show you the locking mechanism. So if you look in here, there's a locking mechanism and there's a lever built in here. So for normal adjustment, we'd push the button and we can adjust that. However, if we lock this at the back and it's left to lock, you can see that it's completely locked. I can't actually adjust that. So this is particularly good if the patient has a cognitive impairment or you're concerned with the compliance. So you want the patient to, the collar height to remain the same. You can also, if you have further concerns, you can actually trim this section off. So you can actually adjust that if you need to. So I'm just going to place the padding back into position. Whenever you adjust the padding, it's really important that we make sure that the edge of the padding is visible all the way around the collar. None of the plastic sections should ever come in direct contact with the patient. Okay, so we're going to fit the collar. So what we're going to do is flatten this out, bring it up underneath the chin, and you can see we're making sure we're getting it level with the tip of the chin there. And I'm just going to fasten these straps first of all, just to get it in the right position, and then we're going to make small adjustments as required. So I'm going to open this up on one side and just tighten this up, and we're trying to make sure that we've got this adjusted. And if we move over to the dynamic camera with Izzy, just come from one side, what's really important is we're making sure that we're not applying pressure at this bottom section. So as we undo it, we lift this section up to make sure that it's sat nicely with the jawline. Now, in this case, you can see this small section is just covering Pete's ear, so we can adjust that if we need to. And these sections can actually be trimmed to allow for making allowance for the ear. So I'm just going to make a few last adjustments either side. Check this. That looks good. And you can see that we've got these two tabs roughly equal, and we've got it nice and symmetrical on the patient. Okay, so now's a good time to talk about some of the different options and some of the different methods we can use. So if we look down from above, you can see that we can actually use the ocean back with this collar. This is a pressure relieving back section. So if you've got a patient that's got an existing occipital ulcer or is at risk of an occipital ulcer, we can actually add this pressure relieving back section to it. And it then means that this contours to fit the shape of the patient's head. So this uses pressure relieving material that will conform to the shape of the patient. It also has a washable cover. So we can actually adjust this according to, we can actually wipe this over if the patient has an exuding wound, for example. This fits in exactly the same way as we do with the standard back, and it should be used when the patient's lying supine or up to about 45 degrees. So we would then remove that. In its standard configuration, the Miami Select, as with other hard collars, is controlling between C2 to C5. However, we can fit a thoracic extension, the Miami JTO, if needed, in order to set that up. Okay. Also, looking at the front, you can see there's a very large tracheal opening, and this just means that if your patient has a tracheotomy, it's very easy, and you may not necessarily need an extension to the tube in order to set that up. Okay, so what I'm going to do is, if we go over to the main camera, I'm just going to have a look at Pete, and we'll just go through the standard fitting just to make sure that this is set up correctly. So looking from the front, you can see that we've got this positioned nice and centrally. I actually think in this case we may just adjust this just a touch. So I'm just going to make a tiny adjustment just to make sure that it's in position on the chin. You do sometimes get a little bit of movement effectively as the patient goes from sit to stand, just because there's increased axial load going through there. You can see that the sternal pad at the moment is locked, but if we go to the lateral side, if we move over to the dynamic camera, what we can actually do is unlock this section, and it gives a little bit more adjustment. So it can make it very useful when the patient is eating or when they're sat down. Looking a little bit higher up, you can see that the sides of the collar are coming up and over the shoulders, making sure that we're not putting any contact on the trapezius muscle. And then looking at the jawline, you can see that we're recruiting all of the lateral jawline to make sure that we're spreading the pressure around the whole of that section. We get Pete to turn around. You can see that it's cradling the back of the head, positioned nice and centrally, and making sure that we've got good anatomical shaping either side. Okay, so we're just going to cover a little bit about the washing and care instructions. So if we just go back to the presentation. So with regards to the Sorbatex, it's designed to have minimal maintenance and care, but effectively for patient compliance, it's really important that you are washing and checking, washing the liners and checking the skin regularly. So the liner should be removed for washing, and then just hand wash in cold water using mild soap. And it's really important that these are rinsed thoroughly. We don't want any soap residue that's left in there, because that can cause problems for the patient. Lay them flat to dry. You can actually just wring out the worst of the moisture or place them between two towels, and then replace them. The blue side is always facing the patient, so it makes it very simple for reapplication of the pads. With regards to ordering, there's only really two main codes for these two. So the collar set includes the collar with spare sets of pads, which we do recommend because it means you've then got one to wear and one to wash. You then have the collar on its own, replacement pads, which can be fitted if the existing ones become worn or need replacement. And there's also the fit tabs. So these are actually means that you can fit those to any of the collars, and it's a very quick way of reproducing the sizing of those so the patient can put it exactly as you as a clinician has set it up. The warranty is 6 months on the frame and then 30 days on the pads. To summarise, the Miami J Select is a cervical collar by Össur that offers the widest range of height adjustability on the market from a single stock item, without having to compromise the quality and integrity you expect from Miami J products. It's a unique first-to-market locking mechanism to encourage patient compliance, and Sorbatex padding to ensure that you're minimising skin breakdown. It's designed to ensure successful patient outcomes. Okay, so we're going to go on to the TLSO. What we'll do is we'll come back to some of those questions. I know there's a couple that have popped up, so we'll come back to those at the end. So with regards to the TLSO, we'll cover a little bit about the indications, the features and benefits, cinching system, how to fit the brace, and also any modifications that you can do. With regards to indications, the brace is indicated for any condition requiring gross immobilization of the trunk and lumbar regions. Effectively, it's a mobilization up to T7. This can be both post-surgically for spinal stenosis, herniated discs, degenerative spinal fractures, spondylolisthesis, and spondylolysis. There are actually two distinct setups of those. So either the TLSO 456, which you can see on the left, which is sort of a similar setup to a backpack. It just has a posterior thoracic extension. And then the 464, which you can have in 3 different configurations. And that just means that you can set this up according to what you need in terms of level of control. The whole system is based around the Miami TLSO belt, and it's a universal system. So we can actually adjust this without need for scissors, and it's adjusted anteriorly, so it makes it much easier to fit and to adjust when compared to the Miami lumbar TLSO. This can also be fitted with the fit tool, which is on the left, or using the sizing reference guide, which is included in the instructions. So you don't actually need to have the fit tool. It's just there as an aid to help you if needed. The way the system works is the belt has a cinching system posteriorly, which magnifies the input through mechanical advantage in order for the patient to tighten this and get it in the correct position. You can also adjust the length of those pulley handles. So depending on your patient's hand function and upper limb function, you can position those exactly where you would need them. These are the different configurations, and you can see that you start over on the left. This is the lower level of control with the PTE version. So we'll show you that one in a minute. And we then have the ATE and PTE over the shoulder designs. This is probably one of the more common setups that most people would use. We then have the option of going for an ATE and PTE configuration with an axillary strap, and that increases the level of control because it's very much firming and stabilizing that anterior thoracic extension. And you can then, with ordering a small extra kit, add over the shoulder straps to this. So it means it's you're very much able to tailor the level of control dependent on the patient's pathology and the level of immobilization that you need. Okay, when comparing this to the original Miami lumbar TLSO, there's a lot of sort of streamlining to this. So we've very much made it quicker, faster, and much more simple for you as a clinician to fit, and it requires minimal preparation whilst optimizing the patient's comfort. The panels themselves have a similar configuration, and you can see these are anatomically sized from a waist circumference in order to give you your size, and there's a big relief down the center to avoid putting pressure on the spinous processes, but it provides some pressure on the paraspinal muscles in order to maintain that in position. This can also be modified, so the panels can be removed, and then just using a heat gun, you can actually heat mold these. Equally, you can adjust the shape, and these can be ground or trimmed for proper relief or comfort. So I'm just going to go on to a fitting now. So if we go over to the table camera, I can talk you through the setup of the system. This is effectively exactly as it comes out of the packet, and you'll notice the posterior section is here with the belt actually already on it. So if I turn this over, you can see that the belt is already added into here. It's a very simple pocket in order to set that up. And the belt is very easy to adjust. So if you look at the front, there are these connections, and then this is a Velcro section. So you can actually adjust that and increase or decrease the length as needed. In order to attach these, the Velcro attachment at the front, you can see here, has a large section of Velcro, and that's very simple just to actually add onto here, and it includes a hand pocket, which we'll show you later in order to attach that back on. Now for the third configuration of the system, you do actually need to add these extra clips onto the anterior thoracic extension. So I'm quickly going to show you how you do this and also highlight the height adjustability of this. So there's a push button system here, and we can actually adjust the height. We can also add an extra link in here if we need to. I'll show you once we go over to Pete, but we can actually increase the height of this even further and add an extra configuration. There is also an Allen key, which means we can actually adjust this, and we can change the angle of this section here according to the patient's anatomy. So that locks and stays into position. So I'm just going to add these extra sections onto here. So this is if you want to do the very highest level of control, the ATE plus PTE with axilla and over the shoulder straps. So I'm just rotating that off, and then we're just attaching this into here. So you can see this is a keyhole shape, slides over the top, clips into position and stays there like that. And we can then clip that into position, and we then repeat this for the other side. So again, keyhole configuration, clips in like that, and then just slides into position like that. Okay, so everything's in situ, and we can then continue from there. So we slide that into position and we're good to go. Okay, great. So I'm going to take this over to Pete, and then we're just going to start fitting this. So we're going to go over to the camera above the couch. So I hasten to add in this, we're not going to utilize correct spinal protocol. The couch isn't wide enough in order to do this. And also it's important that you follow the protocol in your individual hospital. Okay, so this is exactly as it comes out of the kit. You would log roll the patient according to correct protocol. And what we're doing is just passing this section of the belt underneath the patient. It's important to think anatomically about how we position this. So we're pushing this underneath the patient, pushing down into the supporting surface, and we want to make sure that the base of the panel is just at level with the tip of the bottom. So we're making sure that we've got this position correctly. What we don't want is to have it too high, because we're not going to be getting the control down to L5S1. And effectively with the belts, we're wanting to capture the iliac crests in order to maintain control further down the spine. So as we log roll the patient back, we're applying a degree of pressure to make sure that we keep this nice and central and keep it in the correct position. So we're just giving those two belts a pull either side, and I'm just going to slide these up just to make sure that they're positioned correctly. Perfect. Okay, so next we're going to go to the fitting tool, and you can see we slide this across the front. You don't have to use this, but it does make it a little bit easier. We can actually send these out to you. If you request, we can actually send those out, so it makes it much easier. And you can see that we don't actually have to trim these if we don't choose to. So very quickly, anteriorly, we've been able to adjust the belt in order to make sure that it's trimmed to the correct size. We can now take that fitting tool out, put it to one side, and we can then add these two tabs. I'm going to place that just there for the moment. And with these, you can see that we've got these Velcro sections, and we're just going to add it onto there like that. And we've got that positioned correctly. Add this one onto there, either side. And if you've trimmed these, if you wanted to trim those to get the most low profile fit, so we wouldn't have this extra layer there, you'd see it would give you a very low profile fit, but the trimmed end would actually be hidden in there. So it just means it looks very neat. Okay, so we're now going to fit the anterior thoracic extension. So what we would do is just adjust this at the front. Anatomically, we're looking for symphysis pubis, but what we want to make sure is if the patient was to flex, it's not going to make contact with the top of the flexed thigh. And we're just going to slide this up into position. Okay, so we've got a height adjustment mechanism here. This strut can also be contoured, so you can actually bend this to contour it to fit the shape of the patient. And if we look at this from the lateral side using the dynamic camera, what we can actually do is make adjustments to this here. So there's an included Allen key. So we just undo this, put that to one side, and you can see that we can actually contour this to fit the shape of the patient and make sure that we've got a nice low profile fit. There is also the option of adding an extra link. So we can actually take this out in order to bring this up and fit a very long patient. So you can actually adjust it. To ask the question for Javan, yes, you can actually contour this. So if needed, we can actually just adjust this accordingly in order to get a good contour along here. So you may want to just gently get that adjustment. And what's important is when you actually fasten this, we're actually applying pressure on here. So it just means that the axilla pads are making contact and applying control before we start. So I'm just going to tighten this up either side, bring it into position and slide that there. So you can see nice low profile fit across the top, and it's nicely in position so that we've got it in the correct place. Now when we come to connect the belt onto here, again, a very simple system. We undo these two tabs either side. You can also see there's a large piece of Velcro here. Bring the belt over like that, fasten that into position, and it means you can contour it. Now, if you have a patient that is particularly pear-shaped, so they're wider at the hips but then slimmer at the waist, what you can actually do is change the angulation of these belts. So you can actually bring them down like that into a slightly sort of oblique position, and it tightens this section here. But when the patient actually comes to fasten it, Pete, if you can put your hand up on the right, place it in that pocket, and then with this hand you can stabilize the other belt and then just fasten it into position. So what the fitting tool has actually done is meant that we've got this position nicely, and it's dead simple in order to apply it. Okay, before we then go up to the shoulder straps, what we actually do is just undo these two handles either side, and you can see that these are blue is U, so this is for the patient to adjust. And then if I turn this over, you can see that there's a small pocket in here, and then you can actually adjust the length. So in this case, I'm just going to make it a touch longer, but you can wind this round. It's difficult to see because my hand's in the way, but you can wind this round in order to adjust it and get it in the correct position. So once you're happy with that length, you can just adjust it. So I'm going to give these two to Pete with the integrated thumb holes, place that through and pull out laterally and then fasten that over the top. So in this case, these ones are quite long, so we would then adjust these to bring them back to the center. Okay, so we're now going to adjust the over the shoulder straps. So I'm going to make a quick adjustment to this. This one's actually quite short. So just going to make a quick adjustment to bring that into position, and then we're just going to clip this into position. Now I just need to make a small adjustment posteriorly. That's great, and then clip that one in. And then over the shoulder, ignore these extra clips here. I'll be mentioning about those in a little bit. Bring this over and clip that into position. And you can see that these have crocodile Velcro sections in order to adjust it. So those can be adjusted depending on need. And you can just actually tighten those up and then tidy up those two ends like that. Perfect. So we've got it positioned nice and centrally, everything in position. So what we're going to do now is just pop briefly back to the PowerPoint, and then we'll talk you through those configurations, and then I'll show you how you can set those up. Okay, so we've got the ATE, PTE over the shoulder design here, and what we're going to do in a second is we're going to swap over to the camera, and I'll show you the different configurations that we've got here like that. Okay, so if we swap over to the main camera, and you can see we've got the ATE plus PTE over the shoulder configuration. Everything's positioned nice and centrally. You can see that it's nice and low, making sure that we're anchoring it over the iliac crest and stabilizing the pelvis. We get Pete if you spin round. Okay, and you can see here again, nice and central. We've adjusted these accordingly either side. These pads can also be adjusted to wherever you would need, so you can adjust those if we need to. Now, going on to the second configuration, utilizing the axilla straps to stabilize the anterior thoracic extension, what we would need to do, and these are included in the kit, is just detach these front two and then spin round. So if we go over to the dynamic camera, and Izzy's going to come in and show you what I'm doing here. We adjust these and remove those either side. Okay, so we're utilizing the same straps, and then I'm just going to go and grab these pads. So these are strap anchors, and if I show you these, you can see these are included in the kit. Now if I can get you to lift up your arm, Pete. So what we would do is this would normally be applied when the patient is lying down, but I can quickly show you how we would then set this up. So these can be attached wherever we would like on this posterior section. We can also change the angulation. So if, for example, we're wanting to make sure we're avoiding the bust, for example, we can adjust this to wherever we would need. These should also go underneath the traction cords, for the compression cords for tightening those. And this just clicks into, there should just be a single one of these, but I'll show you that extra one later. And then we're just tightening these either side. So positioning that axilla pad, bringing that round and tightening that up so that we've got it in the correct position there, like that. Spin Pete round, like that, and then we then do exactly the same on the opposing side. So I have my strap anchor, and then what I'm doing is actually adding in the strap to that, adjusting that either side, positioning that posteriorly, and again adjusting it anatomically to wherever we need it. Fasten that in there like that, and then if you spin round, Pete, we're just actually adjusting that. Hold on, that's great. Just adjusting that and staying in position. Now, one of the good ways that this is stabilizing the patient is you get a much higher level of control over the anterior thoracic extension. So especially in flexion, you're getting very, very high levels of control. It also means that you haven't got those straps over the shoulder, which sometimes can feel quite constrictive. So it's a really good configuration where you want a higher degree of control, but it actually feels a little bit easier for the patient. Okay, so this is sort of a moderate to high level of control for this system, and we can then change the setup according to whatever we need to include the over-the-shoulder straps as well. So to do this, we order the extra kit, which includes these two clips, which I've already added in. I showed you right at the start. And we can then add these two extra straps, which are either side. So if you spin around and face the other way, Pete, what I'm just going to do is slide these two sections into the PTE, like that. I'll just drop one of those straps, bear with me. Bring this over here like that, place that over the shoulder, adjust that one into position, and then fasten that over the top like that. And then if Pete spins around, what we can actually do is adjust the positions of the pad and clip those nicely into position there like that. So what I've got to do, just make a small adjustment to this, and you can see we've got a combination of an over-the-shoulder design combined with axilla straps to give the very highest levels of control whilst maintaining patient comfort. One of the very good things with this as well is that donning and doffing is a lot easier than with the previous system. So it's very easy for the patient, again, to take it on and off. Again, the blue accents is blue as you, so it means that you've got that set up for the patient. Okay, so if we're then thinking about the other configuration, if we just come over to this side, so we also have the option of having this configuration. So this is ordered as is, and will actually is sized exactly the same according to a waist measurement, which then determines the size of the panel underneath. But you can see this is configured very similar to a rucksack. We have an adjustable chest strap either side just to adjust that and keep that in position. And this also means that the two shoulder straps don't separate and apply lateral pressure to the shoulders. So this can be particularly useful if the patient has sternal involvement, or for example, if the patient is in quite a kyphosed position. It just means you're not applying pressure onto the sternum. Okay. So that concludes the details about the TLSO. What we're going to do is quickly go back to the presentation. And effectively, the key message, the new Miami TLSO directly addresses the needs of our customers. We're trying to simplify the preparation for fitting the brace without compromising the fit or performance. Makes it very quick for you to fit. Lots of different sizes and shapes. and also from a very low stock holdings. There's actually 4 configurations, 4 sizes of these two braces. So from a very small stock, you can fit a real range of different sizes and shapes. The belts can also be adjusted for length according to whatever you need. So it goes up to 177 centimeters of waist circumference. Okay, are there any questions? There are a few that have come through.